so that you guys can connect there. It's a little bit better, but this way we can get everybody all plugged in. All right, Dr. Hibner, how are you?
Hey, how are you doing, Shami?
Doing okay?
Probably a year. No, less than a year, but
Yeah, it's been a little bit of a while. For anybody who doesn't know, Dr. Hibner actually works at Dignity Health, which is an organization I used to be a part of. So we're
nice
old friends. There you go. There's the plug.
yes.
So if you end up in Arizona and you're looking for a healthcare institution with good human kindness, you know where to go. So Dr. Hibner, do you want to go ahead and introduce yourself, a little bit about your background, what you do now?
Yes, so I am actually, you can tell by my Polish accent, I'm actually originally from Poland. I left and I graduated from medical school in Warsaw in 1992, and I moved to the United States in I did an internship, actually in OBGYN at the medical school in Warsaw, and moved to Chicago in 1994. I did my residence in OBGYN at Cook County Hospital in Chicago, and I graduated in year 2000. And then I moved to Arizona, where I did a 3-year fellowship in, at that time it was called gynecologic surgery, and now it's called female pelvic medicine and reconstructive surgery. So I graduated in 2003, and I then went to work at the county hospital here in Phoenix for a year. That's called Maricopa County Hospital.
Mm-hmm.
And in 2004, I moved to St. Joseph's Hospital, and that's where I've been ever since. So I'm actually going to probably sit on somewhere else because the sun is really bright, and I'm going to sit here so
that sounds
I can
great.
see well, and you guys can see.
Perfect.
Well, I'm in my backyard, so you can tell it's actually all very pretty everywhere here.
Well, if you'd like, you're more than welcome to give them a quick look. I know I got to see it a little bit early.
Sure, I will. And so I became a director of the Division of Gynecologic Surgery at St. Joseph's Hospital in Phoenix, and I've been there ever since. And 2006, so right behind me you see those mountains right there. That's called Squaw Peak. Well, we locals call it the Squaw Peak, and tourists call it Payestowa Peak. It's right behind me, right there. And here you see the beautiful sunrise over Pinnacle Peak. So that's a beautiful Arizona nature.
It's not too bad. And Dr. Hibner is actually taking some time. It's about 6 in the morning there. He's got patients in clinic later this morning. And so we're just going to go through, ask him a few questions, figure out a little bit about his journey in medicine. So for any of you who've just joined in, again, this is Dr. Michael Hibner. And I know you shared a little bit about your background and then how you got to the position you're at now. I know that you've also had an opportunity that I think a lot of medical students don't think about in their careers. They think about getting in and practicing medicine, but you've actually been involved in fellowship programs. You've served as expert witness before in the past. What are some other elements of your position that you've gotten to do that aren't just strictly medicine and surgery?
So interesting, Shami, that you asked that question, because I have done a lot of other things other than purely medicine and surgery. I started a fellowship program. I still am very involved with 2 medical schools, University of Arizona and Creighton Medical School, and I am very involved with our residency, OBGYN residency at St. Joseph's Hospital. I've been on the board of directors of big medical societies, and like you said, I've done some legal work. I've done many other things. However, interesting that you mentioned that, because the lately I've been having more and more of those thoughts that let's say the older I get, the much more interested I am in just doing medicine and surgery, and that's really what I like the most. And I know that for younger doctors, it is very appealing to be, to have those administrative positions and so on. But like for me, doesn't have any appeal at all. And I think just the patient contact doing surgery is what gives me the most pleasure in my professional life.
That's really awesome. So I know you're being a little bit humble because I'm aware of the amount of patients that we had actually flying in from other countries to see you in your clinic. And so you have a pretty world-renowned reputation for pelvic pain and surgery at the St. Joe's campus. But what it sounds like you're saying is realistically, throughout your career, there's been different times where you focused more on being teaching faculty versus having an impact directly just with patients, and kind of your interests and what you've spent your time in hasn't been solid at just the same pace. It's actually evolved quite a bit over time.
Well, so the patient care actually, the patient care part has evolved because as well, yes, it's true that I specialize in a very narrow field of medicine, which is pelvic pain.
Mm-hmm.
Initially, it was both in men and women. So I'm a gynecologist by training, but we used to see male patients for pelvic pain. We don't anymore because of certain regulations. But so it's really pelvic pain in women, and the practice is so specific because it's not just pelvic pain, but we see patients for pelvic pain. Pelvic nerve injuries, which
Mm-hmm.
is something that's very, very specific. So for that, we really have patients. When I say we, it's not royal we, it's me and my partners we. We have patients coming from, like you mentioned, from around the world. At least the silver lining of the coronavirus is that now we do the video consults with them. So that's at least one of the positives for us, that those patients don't have to fly from Johannesburg, for example, but I can do the same video conference from Johannesburg. The time difference is a little bit more, so I have to wake up a little earlier.
For instance, to talk with us.
Yes, our practice is actually every year it's getting busier and busier. So it's me and two of my partners, Dr. Castellanos and Dr. Desai. They were both my trainees. So both Dr. Desai and Dr. Castellanos were my former fellows.
Mm-hmm.
So they joined my practice, and so we have there's three attendings, me and two of my partners, and we have three fellows. So it's 6 physicians, and we, between 3 of us, we probably do about 1,500 surgeries a year.
Mm-hmm.
So it's about 500 surgeries per person. I don't know the number of new patients that we see every week, but it's a lot. So it's a very busy practice, and it's only getting busier.
That's really exciting to hear. Now, I'm going to change directions in a second and talk more about medical school, but I do have one other question I just want to briefly touch on from a high level. A lot of the people who are tuning in right now are medical students here in Poznan, in Poland, and I think that something I hear quite a bit is that students don't understand how many options they have for subspecialties. So do you want to just very briefly, like, we learn about the pudendal nerve and like what happens if there's pudendal nerve entrapment, but I don't think they realize that there's a career this specialized. Can you go over just a couple of really common things that you see, or just what your specialty treats in general, and also how many years you put into training to get here?
That's another, great point, Shami, you're making, because what me and my partners do, that's actually not really, that's probably one of my accomplishments, I would say, in medicine, because we really practice a specialty that didn't really exist before I started, or it did, but there were very few providers, and it was very, I would say, superficial. So I'm a gynecologist by training. So me and my partners, we all did residency in OBGYN, a 4-year residency in the United States. We then did fellowships in gynecologic surgery, but that's still not what we really practice. When I graduated from my fellowship and when I came to St. Joe's in 2004, for many different reasons, I became interested in seeing patients for chronic pelvic pain, and that is not really one single specialty, because if you think of chronic pelvic pain and, well, other men and women, it really spans multiple specialties. It really, spans urology and colorectal and GI and physiatry, and actually a lot of it is musculoskeletal pain. So a lot of it is physical therapy, etc., and some orthopedics and neurosurgery. So I, in 2005, when what happened is that I had few patients that would come in and they had this pain that I did not know what it was. So it was this vulvar burning pain that did not fit any criteria that I knew before. Like, it wasn't endometriosis. It wasn't like anything that me as a gynecologist was aware of. And what was interesting is that they were actually, at that time, they were all, I think there were 2 or 3 young women that they had only one thing in common. They 2 of them, I think, did kickboxing. And I'm like, what is that they have this pain and they did this physical activity? So actually what I did is I Googled it. I still remember Googling it in 2004 and, like vulvar pain, kickboxing, or like physical activity. And the name pudendal neuralgia came up. And then once I had a name, I went on Medline. There were about 10 articles on pudendal neuralgia at that time. And like 9 out of 10 were written by the same person, Professor Roger Robert, who's a French neurosurgeon. He wasn't a first author, but like his name was on like 9 out of those 10 articles. And so through a friend of mine here in Phoenix is half French, and he helped me write a letter, and because the French people, you need to write it in French just in case. He helped me write a letter in French to this neurosurgeon. He invited me to go to France, so I actually spent 2 weeks. I was working at St. Joe's. I spent 3 weeks in France learning the pudendal nerve surgery and diagnosis, etc. So when I came to the United States, I really started practicing the medicine that never existed here. So when you're talking about subspecialties, the subspecialty that I practice is truly the subspecialty that I created. Mm-hmm. The pelvic neurosurgery for pelvic nerve compression and pain that is caused by that pelvic nerve compression. So the beginnings were very interesting because at the beginning no one knew what I was doing, to get all the permissions from the hospital, which, St. Joseph's was very forward thinking, and they allowed me to do those things, and which was great because that's how patients started coming from around the country first and then around the world, and I was able to help a lot of patients. That's a very very narrow subspecialty. So in a way, I didn't join the subspecialty that I chose. I created the subspecialty that I wanted to do.
Say that 5 times fast. But realistically, I think that that's really an inspiration to medical students here for a multitude of reasons. One, you're talking about collaboration between foreign graduates and foreign practicing physicians and those who are in the United States. And you really kind of saw an opportunity and took it and made what you wanted to do a reality. So that is awesome. And with that segue, that's perfect timing, because realistically what we want to look at, and I think what a lot of students are interested in, is, as with your role within residencies and fellowships and selecting medical students and residents to come and participate in your program at St. Joe's, what we wanted to get some insight on is, some of the differences you see between those students and residents who are trained in the States versus those who train from a foreign university, and kind of get some of your insight as to what recommendations that you have for them. So I guess the first thing would be, what do you think about students training in a foreign university versus training in the U.S.?
Well, so, of course I'm biased because I trained at the foreign university. And as you know, also in Poland, and as you know, we privately, of course, talked. I know I can't see the rest of the group, but my fiancée, Alex, actually went to the same medical school you're in right now, and she was actually one of the teachers in that English division of the school, or American. Sorry, I may need to go inside. The sun is so bright here. In that same division of the Poznan Medical School. So of course I'm biased. I think that, but on the other hand, I teach at two medical schools here in Phoenix, both University of Arizona. I actually teach anatomy, like in a cadaver lab. I teach anatomy at U of A, and I teach GYN at Creighton. I think that every school, so your school is slightly different because you are going through the curriculum that is more geared towards American students that eventually are going to return to US, which is different than my medical school, because even though I was in medical school in Poland, a lot of or most of the students pretty much stayed behind. There's not that many in my class that came to the United States. I actually last year, 2 years ago, I had exactly almost to date. 2 years ago, I had 25th reunion of my graduating from medical school in Warsaw, and so I went back there and I met all the people, and I think there was only like three people in my class that came to US. So it is different. I mean, I think it's hard for me to compare my experiences from yours, from the experiences of medical students here. Well, having said that, of course, getting into residence and coming back is, as you know, is a little bit more difficult.
Absolutely. So now what about when it comes to Dr. Desai, one of your partners, I know she's trained abroad versus some of the students you see at the University of Arizona or at Creighton. Do you see any sort of difference in either the knowledge that they bring when they do rotations with you, or even just their demeanor, things that they might do?
And so this is going to go on YouTube, and she's going to watch it.
That's true. Oh boy.
Okay.
Yeah. I mean,
I'll tell you guys something that you probably will find. Well, I don't know, shocking. Maybe you've already heard that, or maybe you know that or don't know that yet. But the truth is that at the end, nothing that you have learned in medical school you're going to use in your life and your real life in medicine later. And the same is probably true for residency. So I think at the end you really create your own. Whatever you do is with your medical life is what you kind of create definitely after medical school. So I don't think that the knowledge from medical school is that important to as far as like the level of knowledge. I mean, of course you have to have the knowledge because you have to pass your exams, you have to get in. But in medicine, it's you're almost relearning everything from the beginning, every step you go. So you go to medical school, you kind of start learning new things that you've never known, and then you go to your residency and you start from the scratch. You still start as an intern. So you're like fourth year medical student. You think you're like the smartest, the best, and then you become an intern, and you have your first reality check that you're on the bottom again.
Yeah.
You graduate, and let's say you go to fellowship, you become the first year fellow, and yes, you're still start at like from the scratch because it's a new knowledge. So I don't necessarily think that there's that much difference in knowledge, and I don't think it really matters.
So then, that being said, I think that sets up a perfect segue into my next question. What do you think matters most for students who are trying to prepare themselves to be the best physician? If it's not the knowledge, is it something about the way they think or act or problem solve? What is it that you think they should be doing now to prepare themselves for residency and to be competitive in that area, if it's not knowledge?
I'm going to go inside because the sun is so bright that, so I apologize, I'm moving around, but
no worries, we'll keep up with you.
So I really think so I've been teaching medical students since 2003, and so I've met with so many different students, and I think what really distinguished to me, I mean, I may be wrong, but to me what distinguishes good students from bad students is one thing. It's enthusiasm. It's people that are interested and enthusiastic we as attendings, we as teachers, we can absolutely feel it. We can absolutely sense it, and we are, much more likely to interact with people who are, who ask questions, who are interactive, who are enthusiastic, who are interested. And I actually, for the first few years of my career, probably between 2003 and 2005, I was actually in charge of U of A medical students, like the whole rotation. And so I had to give them grades, and I had to meet with a group of students before they start their rotation, etc. And I would tell them, even if you're not interested, if you want to have a good impression on us, you pretend you're interested. Like, you can hate OBGYN, but don't show it, because people can sense it. Residents especially, they get very sensitive. Because if you start showing them that how uninterested you are, it almost like tells them that they chose the wrong specialty. And I still remember many years ago, probably about 2004, there was this guy that started his third year OBGYN rotation, and like on the first day, when I met with a group, he told me actually his own words, like, I'm not really interested in that. I'm going to be a neurosurgeon. And 6 weeks later, I had to fail him. I remember calling a dean of the medical school in Tucson, telling the dean that the guy is like horrible. He doesn't know anything. And so he had to get a failing grade in his OBGYN rotation. That means he probably never went into neurosurgery. So the point is enthusiasm. Nothing else is as important. You can cover your lack of knowledge with your enthusiasm, if you have any lack of knowledge.
And then use that as momentum.
You probably don't, Shami, I'm just saying.
Well, I appreciate that. So I have a converse question for you. So now we know that enthusiasm is single-handedly the most important piece of this. Now, what do you think, in your opinion, are some red flags, and this is probably tied in with that answer, but things that students have done in the past that you're like, if you're going to do anything, or if you're going to not do something, this is what you need to remember, because it's going to put a bad taste in, your program director's mouth, or whoever you're working with, for the rest of your rotation. What would that be?
Well, again, you have to, and I think probably different attendings like slightly different things. But we at least advise, or me and my partners, we advise our students, when let's say you come to the operating room, first you have to meet the patient, all the usual things, but like, introduce yourself, tell, and creating students, that we teach are actually very good at that. They are actually told that, like, walk to the attending, walk to the residents, introduce yourself, who you are, what the medical student, ask if you can, participate, and ask smart questions. Don't ask stupid questions just to ask them, just so you can show off. Definitely don't talk bad about other students that I know it and he or she didn't know that. That's a big red flag. It doesn't help. It actually really hurts you. It doesn't help in any way. Be prepared. I'm talking about, of course, you guys go through all the other training through medical, pediatrics and internal medicine. I'm much more in the surgical field. So when I meet with students before like their GYN surgery, I actually tell them, when you come to the operating room, your cases are usually assigned to you a day before by the residents. Read about a patient, know what surgery we're doing, be prepared for the questions, and that looks good. No one is going to ask you some super complicated questions, but you have to at least know what procedure we're doing, at least have like some basics of it. So again, be prepared every day, and you can anticipate things.
I think that's really great advice. Mm-hmm. So now I'm going to kind of jump off of that, because I think that's really great. I'm also going to send out a quick reminder to everybody who's tuned in right now. So in about 5 or 6 minutes, I'm going to actually check and see if you guys have posted any questions, or you have questions for Dr. Hibner about anything we're talking about now. Please feel free to post them. We're going to go ahead and address those in a little bit. So good reminder for you guys. But then kind of coming back on this, right? So You've talked about things that you don't want students to do. You don't want them to show off or just ask questions just to look good or to do things without genuine interest, intent, enthusiasm, knowledge, right? Which makes total sense. What is it that makes them stand out to you? Like you're like, that was a really incredible resident or that was a great student. What's something that really stands out and leaves a mark for you?
Well, so most of the things that I mentioned, I think we have to see the enthusiastic students. You want to leave some impression on us because remember, at the end, we write your evaluation, and sometimes when I get like 20 evaluations from students, like 19 of them, I like 2 weeks after the rotation, I don't remember who they were, but I think leaving an impression is really important. Like something that you have done or said, or sometimes even something interesting about you, and sometimes those more private things are interesting. When I write, for example, people. So for a lot of residents, I write them letters of recommendations if they want to go, if they want to get to the fellowship. And usually when I write a letter, people usually write the regular stuff. Oh, this is a great resident, and she was, outstanding, blah, blah, blah. Every letter looks like that.
Mm-hmm.
And so when someone has something more like personal, so just to give you an example, I remember years ago, I had a resident who, for some reason, I don't remember the whole story, but she was, she was American. She was totally from here, and she was fluent in Japanese. And for some reason, I put it in the letter that she's so smart, she was even able to learn Japanese fluently. Do you know how many people came back to me, like people that read the letters, like, wow, I remember that part from the letter. They didn't pay any attention whether she's good, because of course you're never going to write a letter that someone is bad. You're just not going to write the letter, period. So I think that what makes people stand out is what really makes them stand out, like something. So if you and I like that, for example, in students when they have like something different or special. Sometimes I talk a lot to students. I during the surgery, I just talk to them, and sometimes they say things like that, and it's like, whoa, that's interesting. Tell me more about it. And that leaves an impression, that gives you a nice segue later to ask for a letter, for example. And I've had medical students emailing me, hey, I'm this guy that blah, blah, blah. Remember? Can you write me a letter? And I'm like, yeah, I remember, because you and I talked about, I don't know, cars or like something else.
Yeah.
And I find that to be very helpful.
So actually, one follow-up question on that exact topic. When it comes to students or residents, those who are doing rotations with you, asking for letters of recommendation, what advice would you give as far as is there a preferred method you'd like for them to ask? Should they include anything when they ask you? Is there a timeline they should stick to make sure that everything's fresh for you? What does that look like for you?
Well, so for most of the people, when I write them letter of recommendation, I do want them to send me their CV.
Mm-hmm.
Mostly, it's not that I don't know them, but if you don't have that, your letter will be too short, and you want to add few things from that you may not know of, like some details from their CV. It is helpful writing a letter, and I think that the most proper way to ask is if you can ask in person,
mm-hmm.
and then follow up with an email where you send a CV. I think just sending an email without asking in person, unless you really can't ask in person. So we, with our residency, we have those situations. I recently had a situation like that. Our residents go between two hospitals, and with the coronavirus pandemic, we don't really see too many people in person. And a resident emailed me, and she asked me if I could give her a letter because she decided to apply for a fellowship, and that's absolutely perfectly appropriate.
Yeah.
But under different conditions where we actually have ground rounds, like if we had ground rounds and we see each other like every Friday, I would probably rather have a resident walk to me and say, hey, I decided to apply for a fellowship. Could you please give me a letter? And then I would say, yes, send me an email with your CV, and I'll be very happy to write it.
That is awesome.
remember that those letters of recommendations technically should be the person asking for a letter should not really see the letter. So do unless and a lot of people will volunteer and they will actually show you the letter or send you the copy of a letter, but you're not really entitled to it. If you want this to be real, then do not ask the letter to be sent to them. To make it official, you need to tell whoever's writing a letter where to send it.
Perfect. I think that's really good advice for students who are doing this, because sometimes there's some uncertainty or they want it to come off professional and they might actually lose that personal touch that you're looking for in that request. So that's really helpful. And then making sure to give proper direction, I think, is good. One other question that I think students sometimes ask is, if they were to talk to you in person and you said, yep, I'm totally comfortable writing a letter, and say they were to send it to you and then they don't hear from you in a certain amount of time, do you think it's appropriate, either one, for them to provide a deadline, or two, to send any sort of follow-up reminder, or is that something that's considered annoying or rude?
I wouldn't provide a deadline, but I definitely sending a reminder. So different people are different. Like, there are probably people you have to be careful with reminders. Then there are people like me who I'm like totally open to that. I'm just like very busy, so most of the people have to send me at least three reminders, and no one is offended here. I just like get so busy that to me, I either write this letter right away, and if I don't write it right away, the next few hours after I get a request, then I've already moved on to something else. So I usually need those reminders. Some people. So this is kind of a questionable practice, but some people do that, and I don't know if this is right or wrong, but there are people who will ask you, just write your own letter, I'll sign it. I don't necessarily like that, because it's really our job as attendings to write it, but sometimes it is easier. And remember, for you guys in Poland, not to criticize any of the Polish physicians, because I'm kind of one of them from years ago, but people may not be that fluent, maybe writing in English, or like writing a nice letter of recommendation, and sometimes if you have depending how well you know the person, you may actually offer us like, would it be easier if I drafted something, and like say in a nice way, would it be easier if I like drafted something, and would that help you writing the letter? Because it's when you have a day when you have like 5 requests to write a letter of recommendation, that you almost want people to write their own letters, and you sign them. I've certainly done that. I try not to do it, but I certainly had cases where someone said, I really need this letter because like the deadline is like tomorrow. I'm like, well, then you're writing it, and I'll read it, and if I disagree with it,
Yeah, then you can at least use it as a framework, and you can tweak and add your own input, take things out if you don't agree with it. It at least gives you something to work from or give inspiration to.
Well, and and sometimes people that ask you that tell you write your own letter, they'll say, please say that you are good, great, whatever. You have like my permission to say that, because sometimes, I mean, I've had several people like when I was probably still a resident, tell me that, like, write your own letter. I'm like, oh, what do I write?
Yeah.
And so, but if they tell you, yeah, you can say that you're good, because no one is going to give you a letter if you're bad.
Yeah.
The problem, of course, is when someone asks you a letter when you think they're bad, and what do you tell them? But I've learned a way to deal with those people too. I mean, there are sometimes students that come in and I'm sorry, let's just text it. I have people that come in and they say, hold on, did we finish those?
We just lost you. Oh, there you are.
I have people that come in, that students that are actually not that good, and they come to you and say, could you give me a letter of recommendation? And you're like, and then your answer is like, yes, I could, but I don't think my letter would help you. And that's kind of a clear answer, what you think of them.
Yeah, and that's really great. So at least students will have some insight if they get a response like that, maybe just kind of ease off and go another direction. All right. Well, good. So I let me go ahead and take this quick break to see what questions we have. I'm going to start with what we have on YouTube and see if anyone sent anything. Um, some. Oh, did we just lose you? We did. Let's go ahead and call you right back. Hi there. Sorry, we lost you for a second. So
Did we disconnect?
we did, but it was pretty quick. So let's see what we've got on here.
All right.
I'm going to check Instagram as well as YouTube. I know somebody said that they didn't know that they could have them write their own letter. I know I have personally heard of some stories like that. So definitely interesting insight.
Well, you can't write it unless you have a permission to write it. Like, don't start writing your letter, you know.
Oh, absolutely. Well, I think if you were to submit it also from yourself, I think there would be an issue with that. So we do have one question. Somebody said that when you're looking at CVs, either during interviews or during the selection process, what is it that might stand out to you from like a student or a resident perspective that you'd be like impressed with? Or I think another option too, I'm combining a few questions here. Something that would impress you and something you expect to see or not see.
Ooh, well, that's a good question. You know, I think a lot of you know, I think different. So there's different. So to be honest, I don't think we really look at the CVs that closely. You know, I think a lot of times, I mean, things of course may change right now with, you know, with the whole pandemic, and, you know, we may be doing the interviews on Zoom or FaceTime or whatever. But generally the process is that, so, you know, I do interview a lot of candidates for residency. I don't select who comes for the interview. That's the program director's job. Mm-hmm. So generally, you know, the program director will get all the applications, and he and whoever are his people will go through the applications, and they'll look for different things. I don't necessarily think they read CVs. They look at the board scores. They look at you know, medical school, and, you know, and things like that. Then I think, to me, it is actually more important to actually talk to the person, and so the interview, I don't pay that much attention to their CV. I mean, of course, there has to be, you know, the usual things, and things, for example, that so if you choose your specialty, whatever specialty you choose, you kind of want to see some things in there that show that you're truly interested in that specialty. It can be in your CV, but sometimes as a medical student, you may not have had a chance to do anything that goes in your CV. Mm-hmm. So some things you may want to put in the personal statement. So that's another thing you need to write, you know, the personal statement. I have my own issues with personal statement. I can talk about it a little bit more, but again, you know, as a med student, now when we interview for a fellowship, and someone says, you know, I want to be a gynecologic surgeon, then of course in that CV we need to see things as like, yeah, I've published in that field, I've gone to like some conferences, or I presented. So those are the things that you want to see in the CV. I think during the interview process, what I actually probably look at more than the CV is the letters of recommendation, especially if they're from people that are known. So we all know who are the people that are known. So the first thing when you look at the letter of recommendation, you look at the signature line, who actually signed the letter, and then you read it, and so I think that's probably even more important than the actual CV.
Okay, I think that's really, really good advice, to be honest with you. So now, in addition to that, somebody asked, what do you think is the importance when it comes to completing research as a medical student? Does that hold any weight to you when selecting candidates?
Yeah, I think it does. I think it does, and you know, we've had. So again, my practice is so clinically busy, and we have so much here with, you know, our pelvic pain and nerve injuries. We have so much clinical material, but also so much work that I rarely have time to do research, and residents and fellows the same thing. So most of the research in my department, like meaningful research, that was done was actually done by medical students. So I've had several medical students. I just recently, 2 months ago, had a paper came out in like the major journal that was written by Victoria Lim, who was a Creighton medical student at that time. She's an anesthesia resident right now. But like every now and then, you have a student that is like unbelievable, and it's like, I want to do research, and like in her case, for example, she did like 4 or 5 research projects. There's like more papers coming out from the times when she was still a medical student. I think it does pull the weight because it shows that you're really, really interested. And I think not too many students in medical school are able to complete meaningful research. So if you do, that I think carries a lot of weight.
I think that's awesome. We have another question from somebody, and I know that this is just from what you see and the students that you guys get at St. Joe's. But somebody asked, if you were to fail one of your STEP exams, are you still ever considered for residency positions or fellowships, or does that like stain basically your record forever?
No, well, it of course depends what residency. There are residencies that are much more difficult to get into than other residencies, and I'm sure you guys know that, and you're choosing your residencies, accordingly. And no, I mean, no, I don't think so. We have had in the past. Well, I honestly don't know if we have accepted anyone for residency that have failed a step, but I know we've interviewed people that have failed a step. Now, I don't know if we have done that recently, but I know years ago we have definitely interviewed people that have failed their steps. Of course, it's it doesn't look good, but if you pretty much disqualified everyone that had failed a step of their USMLE, then you would have like disqualified so many people, and you can't have them go through medical school and disqualify them for the rest of their professional life. That means that maybe you can't really try for neurosurgery or orthopedics, but maybe you need to rethink your plans of what specialty you want to do.
Awesome. I think that's really fair advice. We have one more question that I have, and then I'll double check to make sure no one submitted anything else, and then I think that's just about it. So almost done. But someone asked, when it comes to research and volunteering that you do as well as electives, does it matter? So I'm going to put their question in terms of OB because I think it makes the most sense. Does it all have to be OB related for it to hold weight? Or are you going to look at that and be like, hey, they put initiative forward to do these things regardless of what specialty it's good? Or is that a red flag of they're not dedicated?
So, that's actually a great question. I'm glad you asked this because I was actually, in preparation for this talk, I was going to talk about that. I think that doing the rotations electives, it's hugely, hugely important. I think it's much more important than anything we've talked about. Because at the end, when for residency, you're choosing a person and you want to know that person. And when you just meet them for the interview, which is, 15 minutes or 10 minutes per interviewer, that's really not enough. So I think so for you guys back there in Poznan, if you can arrange for your rotations in US and the places that you're interested in, you try to do that as hard as you can because that carries more weight than anything else. You should try to arrange it in the specialties that you're interested in, and probably the places you're interested in, because you really want the people that will be choosing you to actually get to know you. My understanding is, and I don't know if that's true, but you probably know that better, that starting this year they're not going to put USMLE scores on the test anymore. It's just pass and fail, like the board exam. Is that true?
Yeah, they're going to start doing that in 2023 is when they make the official adjustment.
Okay. Well, so starting this year, when we actually interviewed last fall, we were not, so even though people will get the scores, we as the program director would know, but individual people, we didn't get the scores because they didn't want us to be biased, which, I kind of disagree with, but we didn't get the scores. We just know pass or fail. So where people actually can stand out is you kind of can't stand out with your scores anymore, which is good or bad, I mean, for some people. But where you can stand out is actually with the rotations, and what comes with that is what I was talking about earlier, is the letters of recommendations. So for example, when I have a candidate that I'm interviewing and then I see a letter of recommendation from a doctor from, let's say, an OBGYN, but like from another hospital, like a big name. The big names count. So if you choose your rotations, if you can do them at like Mayo Clinic, Cleveland Clinic, UCLA, New York, NYU, like things like that, like, because there are big names that stand out. And when people like go through the letters of recommendations, you totally look at the letterhead, like who wrote the letter, and you look who signed it. So those things count. And yes, but try to choose your rotations in the fields you're interested in.
Okay, perfect. Let me just do one quick check. I don't think we have any other questions. Nothing on YouTube and nothing on Instagram. So I think we're all set. Is there anything that you want to basically close with that says like, because I know, sadly, you were supposed to actually be visiting in Poznan and seeing everybody in person, but COVID happened. But is there any parting advice? If you could just tell medical students, like, do this or don't do this, what do you want to leave them with?
Well, good luck. It definitely can be done. I think, out of all the things we talked about, is probably the last thing is, I think, for me, and again, I have probably more experience with people that are residents that come to elective rotations with us trying for the fellowship, but that leaves a much better impression than anything else, than research, than interviews, than scores, so spend your summer, if you have time in the summer, trying to arrange for those rotations, and if you have any contacts, because those things really count. So choose your specialty wisely and choose it. Don't choose it too early. But and I know a lot of students don't know until we don't want you to know in your first year, because if you come as a first year medical student and you already know what you want to do, that sounds like really cocky because you haven't like tried all the other things. But if you're a fourth year medical student and you don't know, then you're kind of screwed, because like you kind of missed on the opportunities to do. So like you probably should, by the end of the second, like beginning of like somewhere like early third year, you should have an idea what you want to do, and then choose your rotations wisely, and definitely by all means you have to do the rotations back home here in the US.
Absolutely.
And I think this is by far the single most important. If you can do research with anyone in US, and a lot of people look for like for in our case, well, we have a lot of Creighton students, but like we couldn't do any research if it wasn't for students. So we always look for students to do research with us. And even if you are like far away, you guys can be very helpful. You definitely can be helpful to people in Poland because of your knowledge of English. Like you can actually write in English, which may be very helpful to a lot of people there, because there's a lot of smart doctors that are like, how do I write a paper and send it to a journal in US? So absolutely, like be in their face and do that.
That is actually really great advice. I think a lot of people forget about the opportunities we have here. So for that, I definitely thank you. But other than that, I mean, that's pretty much it. Is there anything else you'd like to add, or otherwise?
No, that was awesome. I hope maybe next year, if the pandemic is over, I'll be able to come to Poznan in person and meet with everyone.
Oh, we would be so excited. I know AMSA would be excited to have some sort of event where we can get you in front of the students, have them ask questions in real life. But
absolutely.
On behalf of Poznan University Medical Sciences, AMSA, and myself, thank you so much for joining in, and I hope you have an awesome day. It was good to see you.
Yeah, it's good to see you.
All right. Bye, everybody.
Good luck, everyone.